Lung cancer is one of the leading causes of death in the United States and many other parts of the world. According to the American Cancer Society, about 150 per 1,000 people are expected to be diagnosed with lung cancer this year alone. The most common symptom of lung cancer is a persistent cough. This means a cough that just won't quit, even after taking antibiotics for an assumed bacterial infection or trying allergy medicines for a persistent cough due to irritants. As the disease progresses, tumors can grow and obstruct the airways, making it difficult to breathe. In addition, lung cancer can cause inflammation and fluid buildup in the lungs, further contributing to breathing difficulties. However, it is important to remember that shortness of breath can be caused by many conditions, including asthma, allergies, anemia, and heart disease. If you experience any of these symptoms, it is essential to consult your doctor for a proper diagnosis and treatment plan. Early detection and treatment of lung cancer can significantly improve outcomes, so don't hesitate to seek medical advice if you have any concerns. Do you find this video informative or helpful? Tell us in the comments section below. Make sure to subscribe so you don't miss out on future videos. Don't forget to like and share. Stay healthy. Therefore, it is crucial to seek medical attention for an accurate diagnosis and treatment plan. It's important to note that a cough is not a direct indicator of lung cancer. Specifically, it has been found to be an early indicator of small cell lung cancer, a type of cancer that occurs in the cells that carry oxygen to the lungs. When you inhale or exhale, a sharp, severe pain between your shoulder blades may indicate a problem with your lungs or other structures in the chest cavity. Lung cancer can cause chest pain when it puts pressure on the phrenic nerve, which controls the diaphragm. The diaphragm is a large dome-shaped muscle that plays a vital role in breathing. Lung cancer can also cause pain by growing into the bones or other structures in the chest wall. In addition, inflammation or infection of the lungs or airways can lead to chest pain. It's important to note that chest pain is a common symptom of lung cancer, but it's not exclusive to it. Conditions like pneumonia, pulmonary embolism, and heart disease can also cause chest pain. Therefore, it is crucial to seek medical attention for a proper diagnosis and treatment plan. As the cancer progresses, it can cause the vocal cords to become hoarse or raspy. However, it is important to note that hoarseness can also be caused by other factors, such as vocal strain, acid reflux, and thyroid disorders. While hoarseness alone is not a cause for alarm, it should be investigated further, especially when accompanied by other symptoms like a persistent cough or difficulty breathing. Many other conditions can cause a cough, such as asthma, acid reflux, and pneumonia. However, if you have a chronic cough that persists for several weeks or months, it's essential to consult your doctor. Your doctor will consider your medical history and conduct tests to determine the underlying cause. If lung cancer is suspected, they may perform a bronchoscopy to examine the airways and collect tissue samples for biopsy. Lung cancer is often associated with smoking, but did you know that only 15% of lung cancer cases are linked to a smoking habit? There are several risk factors that can increase your chances of developing this disease, such as exposure to radon, asbestos, or secondhand smoke. In addition, several genes have been linked to an increased risk of lung cancer. Unfortunately, many of these risk factors are not things you can control. But there are some warning signs and symptoms you should know about. These signs can help you catch lung cancer early when it's most treatable. Keep watching to learn about 5 interesting common symptoms of lung cancer. No. 1. A cough that won't go away. Number 2. Unexplained weight loss. Losing weight can be a positive thing, but it can become a cause for concern when it happens without conscious effort on your part. This unintentional weight loss is especially worrisome when it occurs alongside other symptoms like a persistent cough. Lung cancer cells can trigger the body to release substances that increase metabolism and promote the breakdown of fat and muscle tissue, leading to unintended weight loss. Additionally, lung cancer can cause a loss of appetite, making it harder to consume enough calories to maintain a healthy weight. While weight loss alone is not a definitive sign of lung cancer, it is important to investigate further, especially when it occurs in combination with other potential warning signs. No. 3. Shortness of breath. Dyspnea or shortness of breath is another common symptom of lung cancer. Number 4. Hoarseness. Hoarseness or a change in your voice is another potential sign of lung cancer. No. 5. Tearing pain in the lungs. While these symptoms are common in lung cancer patients, it is important to remember that they can also be caused by other conditions.